Are we live?
Mm-hmm.
We're live?
We're live.
We're live on Facebook?
I think so.
Okay, excellent. So I'm here with Meg, who's off camera by her preference. And I'm here in DC. This is Andy Slavitt, at A Slavitt, in my friend's house in DC, who lets me stay in his house when I'm here. And it was quite a day today, and it was quite an interesting day in healthcare as well. So this is not my very first experience with Facebook Live. It's, I think, my third, but it's a little bit different because it's a town hall that we're doing in the Healthcare Town Hall project. So you'll have to all let me know how it goes. It's the 8th town hall that we are conducting. We have done 7 really interesting town halls. We've had really amazing reaction. Most recently, last Friday, is that right? Last Friday we went into southern Arizona and to the reddest part of the district in southern Arizona where Representative McSally represents folks. And it proved to me that healthcare really is a nonpartisan issue. It's an issue that's incredibly personal, affects people. So this 8th one we're doing, obviously on Facebook Live, because we can't just get everywhere. I'd love to get to every district. We are going to get to more. I'll talk about that at the end. So why are we doing these town halls? We're doing them because this is one of the most serious pieces of legislation to come in front of Congress that impacts so many people's lives. And frankly, in a normal world, you would have 18 months of national conversation and dialogue and debate about what we're doing, and including all across the country in town halls across America. For whatever reason, that's not what's happening. We're having a process that moves very quickly in DC, and because it affects so many people, and people aren't given a chance to input, I think we're trying to just make sure that people get their questions answered the best we can. My experience with healthcare legislation is when you get a new piece of healthcare legislation, it sticks for 8 to 10 to 15 years. So in no short order, we could be a couple of months away from having something that is signed by the president that changes a whole lot of people's lives. And I think we all know, but I just want to review that there were 3 commitments that President Trump made. The first being that nobody will lose coverage. The second, that costs are going to be a fraction of what they are. And the third is that people with pre-existing conditions aren't going to lose their protections. And all we really need to do is hold the President and the Congress to those three promises. We don't need to get them to make new promises. We need to hold them to those promises. And further, the only way to do that, in my opinion, I think, as we look at this bill, is to take the $700 billion tax cut that is part of this bill and get rid of it. Because to pay for that tax cut, we've had to cut the Medicaid program dramatically. The 40%, bottom 40% would be losing many healthcare services to pay for this tax cut, so that's a problem. But I know we've got an educated audience, so I'm not going to go on and belabor what's in the bill. Instead, I'm going to use this as an opportunity to answer the questions that you have already sent in and to answer the questions that you may send in now. So Meg, off camera, is going to pick through the questions that you've sent and that you're sending, and I will do my best to answer them, and then we'll try to finish up 9-ish. Believe it or not, I've got to go back to the Hill again for more meetings. Okay, so I've kept my time.
So the first question that we have came from Patty in Petaluma, California. She's saying one of the arguments of those who voted for the AHCA was that insurance companies were pulling out of markets in some states. How do you protect the states where this is happening?
Well, thanks for the question. I think we have to first look at why are people pulling out of markets. And the predominant reason right now is that we have the things that are basically the rules of the road that the health plans and the insurers are counting on are being yanked out from under them. So the cost sharing reductions, which is just not to get too technical, but it's essentially the way that we ensure that people can afford their co-pays and deductibles. And see, Natalie couldn't find it. You see that? Those are payments that, if they're not made, will drive costs up by 20%. Likewise, the individual mandate, which, if that's not enforced, drives costs up. And at some point, the insurance companies, who now I would say by and large are making money, I think we went through a period of time where maybe a third of them were making money to now maybe 2/3, and I think in this year, I think we have the majority of them are making money, but still they can't continue to participate when they don't know the rules. So first thing is we have to put a lot of pressure on the administration to just stop the games. And then we also have, I think, more of a long-term competition problem in healthcare, which is that, particularly in rural areas, we don't have enough competition. And because that's the case, we need some more long-term answers, and that could include things like a public option and other kinds of things. But I'll stop there. Meg, you have another one?
Sure. So a lot of questions asking for sort of details to better understand AHCA. One is from Jessica in Hollywood, Florida. She asks, under the Republicans' healthcare proposal, would insurance companies be able to deny coverage for emergency care and hospitalization? Would insurance companies be able to charge women higher premiums than men?
Okay. So under the Republican proposal as it sits right now, we would be moving the decision from the government, which protects essentially and requires the services, a minimum set of services be covered, and that people wouldn't be able to be charged more if they had pre-existing conditions, to allowing the states and insurance companies to be able to make those decisions. And so when people's favorite example is, well, why should a man have to pay for pregnancy coverage? And I could argue that, and I could win that argument about why men should pay for pregnancy coverage. After all, we were part of that process in a couple different ways, both as kids and then some of us as adults. But that's not really what happens. What really happens is insurance companies, when they can decide, they decide, well, I'm only going to cover 2 emergency visits per month, and I'm only going to cover, and I may not cover mental health, and I may only cover certain kinds of hospital visits, and it's all in the fine print. Once you allow that to happen, and it becomes very hard to shop and compare insurance products. So yes, unfortunately, if the Republican bill were adopted from the House exactly that way in the Senate and signed by the President, that would be a concern.
This question is from Catherine in Easton, Pennsylvania. She's wondering, does anyone or any state government have standing to bring a lawsuit over any of the efforts to destabilize the ACA, like refusing to pay CSRs or to enforce the individual mandate?
Yes. It's probably a more complicated, longer answer. But yes, there are organizations that do have standing, and you can expect that the administration will have to deal with those things that violate the current law. Yes.
Another on sort of bipartisan opportunities. Sharon in Hanahan, South Carolina, is curious about, when she's writing to her elected officials about fixing the ACA, what sort of the short bullet points are that she could give about what to recommend to them.
For bipartisan ideas? Yep. Well, look, I think, let me just talk a little bit about the process. I think there is a bipartisan potential, but generally that will occur if the partisan effort looks like it's not going to succeed. So I think job one is to make it clear that as a country that we intend to hold President Trump to those promises. And then there are a host of bipartisan ideas and fixes if people were to get around the table. I think as for the exchanges, reinsurance, which I think has worked in Alaska and has worked in other places, is a good proposal to make. I think you can make a very legitimate case that the subsidies that exist in the ACA for people that are 400% of poverty or below should also exist for people above 400%. The reason I say that is because if you're employed or if you're Medicare or Medicaid or veterans coverage, you have a government paid for benefit. And if you're under 400% of poverty level, you have a government paid for subsidy. So the only people that aren't getting a subsidy from a fairness perspective are people over 400%. So I think that's a second idea that I think could be framed in some ways of paying for. So those are a couple of thoughts.
Great. Another question, another question about bipartisanship here, or working with folks across the aisle in the Republican Party, from Becca in Laramie, Wyoming. She's saying, realistically, Wyoming's congressional representation isn't likely to change anytime soon in the future. What are ways that people can best communicate with their governors in their states to help make the ACA work better there? And in particular, she's sort of curious about rural states where people are perhaps frustrated about
Sure.
access.
Well, look, you've got a very important senator in Wyoming, and Senator Barrasso, who's a physician. And rural states are going to be feeling a significant amount of pain in the AHCA changes for a couple reasons. One is that when healthcare is more expensive in rural communities, the tax credits are just going to be insufficient. So your senator, any of the senators who represent rural areas, which is pretty much every senator, ought to be very concerned about that and about the tax credits, and they ought to make sure the tax credits are sufficient and that are tied to the premium levels like they are during the ACA. So that's, I think, important. And if you're in a rural state, not like Wyoming, but like other rural states where the Medicaid has been expanded, that would potentially go away if the current Republican bill that came out of the House passed. So I think those are important points to make. Governors, I think, are a really important voice in this chorus, but I think you just have to distinguish between governors in states that have expanded Medicaid and those that haven't.
Great. Building off talking about speaking with your senators as well, Tom in McIndoe Falls, Vermont, is curious what it will take for the Senate to prevent AHCA from becoming law at all, what the strategy there is.
3 votes. And let me tell you a little bit about those 3 votes. You'll get a lot of senators who will be willing to say that they don't like the House bill, or they have concerns, or what have you, which is fine, but not sufficient, not committal. What you really need is you need 3 senators, and ideally more, that will stand up and publicly say right now, early, I will not vote for the ACA unless we don't cut Medicaid and we fulfill the president's 3 promises. So getting the senators to say that now will change the entire process. Because right now we have a process in the Senate that Leader McConnell has begun, and it will be when he and they are convinced that there are enough senators, and it doesn't take a lot, there are enough senators that are solidly and won't vote this, that aren't just criticizing the law, but are actually saying, I'm not voting for it under no uncertain terms. So getting your senator to come out early and say that is where they need to show some boldness. And I think with a lot of the things going on, the Congress in Washington, White House, etc., that's a theme for our senators, that they actually act as a check and balance for us.
And to further on that point, I know given events even today, a lot of people are probably sharing this question that Hannah in New York had, which is how to continue to maintain momentum and engagement on this issue, given everything else that's happening in other issue areas and just the sort of continuing swirl of legislation as well.
Yeah, so look, this is a fantastic question. I mean, I've been writing a piece for USA Today on a pretty much a weekly basis, and I'm not going to write one this week because there's just too much noise and coverage on all these other things. And so, it's almost like the zone is being flooded with chaos. And we got to be very careful about that because that could mean, on the one hand, it could mean that the Senate moves its attention and that delays things, and that's positive for people who are not excited about the law or the bill. But there's another theory which that creates a lot of cover and a lot of work gets done in the Senate and people don't pay attention. So reminding people that this is a true north and that while there's a lot of intrigue going on in other topics and other areas, that this can't be let up. I would say there's going to be a recess week, which is Memorial Day. And look, I know everybody wants to get out on whatever they do on Memorial Day, have a picnic and so forth. But that week is vital for the senators to hear what people are thinking.
Great. And then there, like I said, several questions about impacts. So another question from Scott in Pittsburgh, Pennsylvania, was about possible impacts on group plans from AHCA and how those with especially chronic illnesses might be harmed by the bill, and any other protections that you want to make sure people know could potentially be lost given some of the misinformation that's happening.
Sure. Yeah, I mean, group plans could be impacted in a couple of ways. One is I think there would just be a general shrinkage in the number of people covered by group plans because of the employer mandate going away. So I think the number from CBO is about 7 million people to lose coverage. But then the things that are protections from the ACA, protecting against lifetime limits and caps, protections for essential benefits, and so forth, those would also go away. So people with chronic conditions, I think, could find that those rules change on them. And Matt Fiedler at Brookings wrote a very good piece about this if some people want to look it up.
Great. And then let's see. Any other advice that you would give to moderate Republicans right now, ways that they could, again, sort of find a way to move forward on this without giving up on making improvements, but not hurting any Americans? And that's from Lauren in California.
Look, I think moderate Republicans are going to want to show that they're taking some action, but they want to show that they're taking action that makes sense. And so I think the earlier question, which asked what are some good ideas for moderate Republicans, is appropriate because they have to be, I think, my judgment is, able to say that this process that's started, that's not very inclusive, that's sort of all-male 13 folks, to say there are other ideas and better ideas, and the stronger they can be and the earlier they can be in saying, we are not comfortable with this process, we want a more inclusive process, that will put us on an entirely different track, and it doesn't take very many for us to get there.
Great, and just looking to try and be able to get a little bit more feedback from folks following along.
Okay.
But anything else, I guess, that you would want to let people know, especially maybe about Medicaid, since those were questions that we didn't hear quite as much about, letting them know implications for folks on Medicaid now and what it might mean for them in the long term as well.
Yeah. No, I have a tremendous amount in my Twitter feed about Medicaid, and gotten to learn a lot from parents who have kids that are reliant on Medicaid. And I think most people don't realize that half the people on Medicaid are kids, and so many services are not covered by anybody except Medicaid. Even people who have commercial insurance, if they need services to give them any kind of quality of life, if they're severely chronically ill or disabled, they need Medicaid for that. And so this bill cuts Medicaid by 25%, $880 billion. I have not been able to have anybody tell me how people are going to get those services if that happens. So I think that's important from a substantive perspective. From a political perspective, I think this becomes the most important issue in the Senate. I know a lot of Americans started paying attention when pre-existing conditions became an important feature here, but I think it's even more important now to focus on Medicaid, and a lot of state budgets will lose a lot if Medicaid expansion goes away and if Medicaid caps come in and so forth.
And that actually, I'm looking at Twitter now because it sounds like some folks are having trouble with questions on the Facebook stream. So if you want to tweet at Andy, I can check there for questions as well. Moats like Kodak asked about the Medicaid expense ratio, noting how efficient Medicaid already is in comparison to private insurance. So sort of asking for your reflections on...
That is an educated question. Thank you. So Medicaid is 18 to 25% less expensive than commercial insurance. So all that we hear when people say Medicaid's broken, actually more physicians take Medicaid than they do commercial insurance. So that line that not enough physicians take it is garbage. Secondly, it's already more efficient. It's 18 to 25% less expensive. Third, on a per capita basis, in other words, on a per person basis, the medical cost trend is lower than it is in commercial or Medicare. So it's an incredibly efficient program, and it delivers a far more comprehensive set of services on top of that. So that really shoots down this argument about why you'd want to have a per capita cap or why cutting Medicaid is such a good idea. I think the idea that you can cut Medicaid and therefore fix the problem of getting more physicians to see Medicaid patients doesn't make any sense, right? Because if you cut it, then you're cutting reimbursements, and then fewer people are going to take it. So it's just basically a fallacy, and it's just perpetuated so that they can put forward a tax cut that they want to pass. So very important, essential question that Medicaid not be cut.
Great. And then just trying to scroll through and
Sure.
see who else we have here. Sorry, I'll try to be as responsive as we can.
Sure. While you're doing that, maybe I cover one other thing. So by the end of the week, we're going to announce some more town halls. That's the good news. It's exciting news. We're going to do them in, I would say, the goal is to do them in at least 5 states in person. We may even do a few more telephonically. Maybe we'll do another Facebook one. Sirius XM offered to host one that we may do. I think, and obviously we're targeting them in places where we have senators who we think are very important to be focused on these issues. And there's like a lot of little Twitter bugs flying across the screen. That's a lot of little birds tweeting. Yeah.
Great.
Okay. Should we have another question or two, or are we?
We're just about at 9 o'clock, so maybe if we want to...
Probably nobody watching anymore.
I'm not sure.
Well, so anyway, if you tuned in for any of this, either live or later, thank you. Hopefully this was good. Meg, thank you. You're awesome. You're now like a producer. We should get you like a Hollywood credit. And if you think that this is valuable, you feel free to give us feedback. If something didn't work right, I'm sure you'll let us know, because that's how Twitter works. We'll get all we'll get all of the stuff that didn't work. But thank you. Now we got to press a button to turn it off.
Yep.
Okay.
Take care of it.
All right. Thanks.